Welcome to the Beats from the True Wellness Center. I'm your host, Kelly Kennedy, and the Beats is truly from my heart to yours to help you empower and inspire you to learn how the body actually does work. I am bringing you my friends, my colleagues, the most incredible minds from around the world that I have been able to learn from, and I want to share them all with you. So that's what the Beats is really about, is teaching people what I've been able to learn about how the body works and trying to give that to you in a very simple and practical way to give you things to change your life, because you got this. This is all about you and having the ability to heal your own body from within. And that's really my message, is from my heart to yours. Welcome to the Beats. Welcome to learning how your body works, and welcome to opening your heart. Thank you for joining us today. Thank you for your time and your attention as we focus in on this week's episode of The Beats. So welcome back to The Beats with Kelly Kennedy, and I am so excited to introduce to you today Danielle. And before I introduce Danielle, I'm going to do something on camera as I did last time that I had a lot of firsts on the last podcast. This is going to be another first. Before I start the podcast with my guests, we take a few minutes to, I know most of these guests pretty well, so we're just kind of reconnecting and getting to know each other. Danielle's one of my newer good BFFs, but I usually do some kind of like a prayer with a tuning fork and just set the tone of the day. And it struck myself, and I could feel it from Danielle. She's like, yeah, let's do it on camera. So I'm going to do it now, and Danielle, you're welcome to add in. So we'll just start off like this. So I set the intention today and pay attention to Danielle and I staying in the flow state, coming truly from our hearts as we first connected and reconnected this year on all things to uncover one of the most, what I find, ridiculous things that's happening in our culture that Danielle's shedding light on to really educate people about. And I pray that today, all the words that come out of our mouth, all the nonverbal communication truly assists those that are listening to truly hear this and feel this information, allowing them to make proper steps forward, allowing their nervous system to heal, allowing them to understand the different levels, physical, emotional, and spiritual, that all things are entangled with, and that as we uncover the blockades to healing, we truly allow the body to heal itself. And that Danielle and I continue to be light, and even though it's a very heavy subject, to allow this to truly reach those that want and need this information, and that we have the ability to communicate in a very heartfelt, authentic way what we're trying to communicate today about breast implants and about lymphatic and fascia and all things that Danielle and I love ever so much. And electricity, and so it is. Did you want to add anything, Danielle?
I think that was perfect.
So Danielle Valoras, I mispronounced it, sorry. Danielle Valoras is a wonderful nurse practitioner that worked more in medical equipment, working in the cardiovascular industry. I'm going to let her talk a little bit about that. It's very interesting. And I would love to say I met Danielle this year, but I have to say it was kind of a funny experience. So I'm at Cellcore Eco event, which I love and I go to for the last couple of years. They're absolutely amazing. One of the best microbiology classes you can possibly take in the United States for advanced practitioners. And Danielle was one of the last speakers right after Dr. Schaffner, and we were fascinated by her subject matter, which was breast implant illness. And this is something that I want to bring a lot of light to as well, because I've seen it in our practice and with our client base working in lymphatics and fascia. But as Danielle's speaking, she's talking about all these things, and I was like, oh my God, how do I not know her? Wow, that's so interesting. Yeah, fascia, lymph, yeah. Then she throws up a slide, she starts talking about Flow-Prezo. I'm like, what the hell? How does she know about Flow-Prezo? I don't know this woman. Oh my God. Then she starts talking about Doylestown, Pennsylvania. And I was like, wait, what is happening? Who is this woman? How? And for those of you who don't know, Doylestown, Pennsylvania is 10 minutes up the road from where I live. And she's like doing research with a plastic surgeon. I was like, what is happening? How do I not know this woman? And I go up, and of course, Idiot. I was there last year at Cellcore. Danielle came up. I met her briefly. Not Doctor, Peter Howe put her on Flowprezo the next day when I had to leave, and I didn't have a great deep time with her, so unfortunately I didn't remember. But when I went and hugged her afterward, was like, I need to know you. What you're doing is amazing. I want to work more with you. And we had just an instant connection. And as the universe would have it, put us on a plane that was delayed, upgraded me to first class, and we got to sit next to each other for like 3 or 4 hours. And just I'm sure everybody up in first class was like, I wish these two women would shut up.
Well, they actually said that.
Yeah.
We're talking now.
Yeah, exactly. So tell us a little. Thank you for your time today. I know you have a lot going on. You have a summit coming up, which we wanted to talk about as well. And so I know how busy that is as you're getting to crunch time. So thank you for giving us your time today. But we really have a true passion. And so explain to them about your background and how you got to where you are. Whew. It's interesting.
Well, yeah. So
start when you were born. No,
when I was born, and we walked uphill both ways to school. No. So I graduated PA school in 1999. And before that, I was in industry, and they call us field clinical engineers. And what we did was for me, it was pacemakers at the time, and ablation technology, and internal cardio defibrillators. Those are class 3 medical devices. I promise you this fits into what I'm doing now.
Yes.
But then I had no idea, right? I'm learning research, I'm learning regulatory, I'm helping people put in implantable devices, and then we follow them for a long period of time, and you get to see how they are. And in hindsight, it's quite intriguing that many people that receive a life-saving device, they definitely get to have more life. And you can see them, when you have congestive heart failure, sometimes you deteriorate over time and the quality becomes different. So fast forwarded a little bit later in life, I'm 48 years old, I lose 40 pounds, and I decide I'm going to get breast implants, right? Like, why not? They're class 3 medical devices. I read the research, just like what I have been doing for the past 30 years. And I went to a very reputable plastic surgeon, and they said, you know what? I think augmentation breast implants would serve you best. So I get the breast implants. And 3 months in, I started to, I felt like I never healed from the surgery. Now I know I'm data dumping a lot, trying to get a whole bunch of years into a small little package. I had something called Graves' disease, which is a thyroid disease and autoimmune disease. And I got breast implants. What was not disclosed to me was that if you have an autoimmune issue, or asthma or allergies in your close-knit family or yourself, then breast implants might not be for you, because it can trigger more, let's just say, inflammation, and then that can exacerbate your autoimmune disease or have you get another one. So I think for me, in that first 3 months of having implants, I was impacted so quickly because I had an autoimmune issue. And it took me about the first 6 to 9 months, I just had insidious symptoms over time, like hair loss, fatigue, swelling. My ankles were just incredibly swollen, and then knees, and then.
Did you relate it to your breast implants at the time?
No.
Okay, why that's what I'm wondering. Right, you just got breast implants, and then next thing you know, you're like not feeling well. You just lost all this weight, and so I'm sure you were trying to figure it out as a PA, as a brilliant woman that knows how to research.
Yeah, but in Western medicine, you go to in Western medicine has its place. Like, that's where.
Of course. Yeah.
But like the ER didn't know how to help me when I had the migraine. They thought I had like a brain aneurysm, and being worked up for all of this, and I didn't have a brain aneurysm. It was an exertional migraine and things like that. But they have to cover themselves, and each time, whether it's family medicine, orthopedics, neurology, I'm like, do you think it's the breast implants? like at that time I was just thinking the linear weight of them here, head, making your head posture forward, shoulders rolled forward, because that was, I think for me, was maybe 2.5 pounds added, literally overnight with the
Right.
cc's that I had. And so I just thought it was weight, and the plastic surgeon said no. Like everyone was like, no, it's something else. So I went through
Because of the migraines, right? Because what you were primarily dealing with was head pain. So you
head
thought
pain.
maybe the muscles were being stretched because of the physical additional weight that
Yeah.
was added to your skeleton that then caused you to maybe do headward forward position, rolling up, and you're like, oh, that's why I'm getting all these headaches.
Yep.
That was your
And then,
differential at that
yep.
point.
And then the fatigue was in my brain because I wasn't sleeping well, because of the headaches, because of the stiffness. And then as I looked, this is where I started to get really into the lymph and the fascia. Then you start to look at the brachial plexus and the cervical spine and the cervical nerves and or cranial nerves and the vagus nerve and all of that. And I was like, huh. And so that was the route I went. And everyone said, no, you're wrong. I don't think so, but take this medicine, see if this makes you feel better. Like it was always chasing symptoms. And then I had a colleague, a field clinical engineer guy, say, I think you might have something called breast implant illness. And I was just like, what? Like, what is this? And I had already had a schedule to have them just removed because we thought maybe it was the weight, right? And then I looked it up and I was like, oh, I need to take the capsule out too, because it's like the catcher's mitt. And I didn't even have the implants for 2 years. And this October 31st will be 5 years explanted. And I tell you what, when I woke up from explant, I knew I had done the right thing. Like my breath was bigger. I felt lighter. It's the weirdest feeling to feel like you can breathe. It wasn't like I wasn't breathing, but the weight was lifted. So I thought, oh, maybe it was the weight. But then the fatigue, the swelling, everything went away. Like about 70% went away.
Hmm.
And I was just like, there's something more to this than just the weight. And then from there, I just started to dive in, and I then looked at how they did their research to make it an approved class 3 medical device and all the things. And there was just a bunch of mixed matches for me. And so just diving down deep in that, and then the summit, having more people who study this more, better, different than I do, from immunology to explanting to radiology, to molecular biology. We all get together every 2 years to discuss where the research should go, where it can go, and how do we best support people who have breast implants, right? So if anyone's listening and you have breast implants, like, we now have ways to objectively measure if you're concerned that your breast implants might be impacting you and things like that. So that's that in a nutshell.
Well, there's a lot to unpack there for
I
sure, but
know.
I want to bring up a couple things first and foremost, which is for us as bioregulatory practitioners, scars are going to block the nervous system from healing. So when you go get a breast implant, and you're going to have a scar. And I'm going to back up one thing and just say this. I know this is a sensitive subject. This is a sensitive subject for every woman and every man that listens to this, that knows somebody that's been impacted by either considering breast implants, having breast implants, as well as any other
Surgery.
any other surgeries or implants. Like, it's a big deal, and we don't take this lightly. And I appreciate, there was a client years ago that when I do my initial intakes with clients, I ask all sorts of questions about scars, about dental implants, about things that might be blocking their nervous system. And she had been a client for quite a few months, and she wasn't getting better, and I couldn't figure it out. And on her research, she came back and said, I had breast implants, and I think I have breast implant illness. She had a mixed connective tissue disorder, which is a horrible diagnosis. And so she was able to explant and all that. But it was honestly, I I fell on the sword and was like, I'm so sorry. I never asked that. I never considered breast implants. This was maybe 8 or 9 years ago. I just never did. And now it's like, do you have dental implants? Do you have breast implants? Do you have
An IUD.
gluteal implants, IUDs? These are all. And asking somebody to get rid of something that you got because you were already in a position of thinking emotionally like, hey, I need to look better because I don't like my body. It could look better. And then asking you to then remove that because it's making you ill potentially or could. I get the emotional piece to this. And Danielle and I are going to talk about that. So I don't want any of you listening to think that I'm flippantly talking about, oh, now we're going to get the breast implants out. I just want to talk about all the things that breast implants affect in the body, because I think, like Danielle, this is a frontier. Like, how many thousands of women get breast implants a year?
Thankfully, it's lessening, but it is like 250,000
A year. When
a
she
year.
said that statistic, I was like, I talk about can't breathe. I mean, I verbally was like, oh, and there was 2 times in her presentation, I think she looked over at me because I was like, oh, I was shocked. I was sitting next to Dr. Schaffner. I was like, can you believe this? I am blown away. I just didn't know what the process entailed. I mean, as a stick figure young woman, I honestly considered it in my 18 to 23-year-old range. And it was right after the car accident that I was like, there's no way I'm going under the knife. Like, I just have no desire to do that. So that is the only thing, honestly, that stopped me, is my hesitation to go under anesthesia. Outside of that, there was 1,000 reasons in society and looking in the mirror that caused me to want to get breast implants. I mean, I am a very small A cup, like ridiculous, could not wear a bra the rest of my life and nobody would probably really notice. But I've learned to love my body now, and I've learned to get through that. But that has taken a long time, and I'm so thankful that I'm so scared of anesthesia that I didn't do it. But there's a lot of women that did, that weren't scared of that, and this is why we're having this conversation, to talk about when's the right time, if it's right for you, and why we want you to consider it, because of what Danielle has uncovered and will continue to educate us about.
Yeah, and at the end of the day, just empowered, informed consent. Like, we ideally, most of us who are going through this trajectory are adults, and we get to choose what we do with our bodies, with our minds, and that's a privilege. Not everyone gets to even have this contemplation, right? And then there's another trajectory of people who have breast cancer, and then what do you do after a mastectomy? And the gold standard is to have expanders placed and implants placed, and they're actually the higher risk group, right? And then the reconstruction revision is a high risk group as well. And so it's a tough call. I'm looking for breast implants to be safe. I'm looking for people who have breast implants to know the risks, so we know what to look for, but not run out of fear, not do things out of like this shouldn't be a fear-based conversation. And yeah, I think just to empower people. And when I first heard, remove the implants after putting them in, that was hard, because one, I just put them in, but if they were making me this sick, I have to take them out. And then the emotional thing was like, I did this to myself, and you feel like death when you're at the peak of what we call breast implant illness. It is not, I don't wish this on anyone. And we have choices now, and we have screening now. And so let's go over that a little bit. So if that way people know that they can look to see if the breast implants are impacting them.
Yes, please.
The imaging study that we can do is what they call a breast MRI, and it is best if you use contrast, because you can see more when you have contrast. Many people are allergic to contrast, so you have to make that discernment. And then they look for the breast implant integrity versus the trajectory of mammogram, ultrasound, breast MRI. This is specifically to look at the breast implant integrity. and then you can take that file and send it to, we'll put it in the notes. Dr. Eduardo Flores studies silicone-induced granulomas within the breast implant capsule. And he will assess the imaging. He and his team will assess the imaging for free. And if you have this granuloma, sometimes it's really small. It just means that your body's responding to the implant, and you have an inflammatory cascade from that implant. And any practitioner, the first thing you're going to do, is let's take away the inflammation, get you out of the mold, get you out of the situation, remove the toxic load, and then help you heal from that, right? So that would be my objective sign that says, okay, we need to consider explant, right? And if you have symptoms and this granuloma, then move towards explant faster, you know, in a timely manner, start to save up financially and do the things. And if you don't have symptoms and you have this granuloma, maybe you have a little bit more breathing room. The goal is to remove before you have symptoms or before you get a diagnosis of connective tissue issues or autoimmune. By the time you've gotten that designation, it's just harder to, you can still optimize health for sure, but it can be harder in a longer road, that's all. So looking for that sign and looking for a practitioner that can help navigate you that way would be a good idea. And in the interim, keep that lymph open.
Yes. And move. Yeah. I want to talk about, and thank you for bringing up the lymph. Yes. Keep pumping those lymph nodes. If you don't know how to do it, go to the website, the True Wellness Center, pump your nodes, get some topical ointment. Dr. Schaffner's lymph flow cream is amazing, or Iteries is incredible, to really get your nodes moving, because as Danielle said, if the leak is still there, you've got to make sure that the toxins are moving out faster than they're being exposed to them. And if the breast implant is still placed, or the IUD or whatever the implantable device is still placed, and the body's responding and reacting to it, then the leak is still there. No different than if you still have silver fillings or root canals in your mouth, that you got to really be diligent at keeping up, because there's endotoxins that are created essentially from the body trying to fight what it sees as foreign material or foreign invaders inside the body.
Yeah.
But I want to talk and back up a little bit for those who don't know, because I certainly didn't. When clients come in and I ask if they have breast implants, I ask a question: is it silicone or is it saline? And
I know, right?
I was blown out of the water by this one. Can you go through that a little bit? I don't want to steal your thunder, because I was like, wait, what? Wait, what?
Yeah, no, it makes no difference, because the shell, the envelope that contains the whatever on the inside, is silicone, and it's cross-linked, and it's a polymer, and this polymer has gaps or sheds or degrades, and that is the first handshake your body has with the implant, and that is the response that your body will react to and make the capsule around that, right? And it's making a capsule to ideally protect you from.
So there's an envelope that they place inside to put the implant in, right? So it's like a shell.
The implant, right, is just a shell, like a almost like a ball, a flat ball.
Like an empty balloon.
If it's saline, they'll put that in deflated, and then they'll inflate it with saline, sterile saline, and that's how some of the saline ones work. The gel ones are already filled, and they put it in fully formed.
But all of it's in this
capsule.
This capsule, which is
this well, let's call it
envelope,
an envelope or a shell.
An envelope, a shell, but that's always silicone, even if they're filling it with saline.
Yeah.
Always.
So if you have saline, you have a silicone implant.
Right. And then that silicone envelope is a little porous, is what you're saying. Yeah. And so the body creates a non-porous envelope itself around the envelope of fascia.
Yeah, but I wouldn't say it's non-porous.
Okay.
Because we know that it migrates. We know it's like the best collagen type matrix of all good stuff to hold that breast implant in place and to protect you as best it can. And some of us make a very thin catcher's mitt, and some of us make a very thick, contracted catcher's mitt, right? But stuff can get through that defense system that our body has made, and then it migrates into via the lymph, via macrophages and monocytes and the whole 9 yards, and travels throughout the body. So when you have a breast implant, from day one, you are being exposed to silicone. You are being, they call it gel bleed. The companies know that this happens, and they know that in an intact shell, we get mostly silicone of different molecular weights, platinum and tin. We get some other good stuff too, but those are the bulk of the weight in the testing that they did. So
And
it doesn't matter.
the fascia is creating basically scarification to wall off this foreign object. And what Danielle's saying is that no system in the body is closed. There's no system in the body that's closed because of the fascia, because fascia literally touches every single aspect of the body. And so you can't unwind it. And she's going to talk more about that because she just came back from the Fascia Conference, and we want to delve into fascia a little bit more too, because it's so fascinating. As much as we love lymph, I think we're more in love with fascia. Would you agree?
Well, it's all together.
Yeah, it is. Yeah.
You can't have one without the other.
Yeah.
And one other thing, if we're talking about scar, right? Here we do. I kind of do this at every podcast, but
Yeah.
we think the scar tissue where they put the implants in is here. They can go in the arm. They can go around the areola. It's the breast implant. That's your scar tissue. 360.
That's right.
Right? If it's under the muscle, it's scar tissue in that fascial plane. And then they cut the muscle, right? So we think it's just what we see in the scar tissue of the C-section, or the scar tissue of, the knee, or the different things, but it's inside.
It goes so deep. And when that was the other, when you showed the picture of the cutting of the pectoral muscle to place the implant under it, my whole nervous system was like, shock and awe, because it's so.
I did not know they did that.
I didn't know they did that.
I would never have, never ever, and they just didn't disclose that they did that when they went under the muscle. Under the muscle should be best for you. Okay. It's a fascial plane at that time, right? It's a fascial plane where, nothing exists, and you can just open it up and put something in. That sounds great. And the only reason I knew
But there are no empty spaces in the body, and you're cutting tissue that then the body has to repair from, and it's going to affect tensegrity, all other aspects of the body. So let alone the silicone leakage and the saline potentially bursting, it's about the scarification for me, and the interruption of the nervous system tissue and the interruption of the communication.
Just think about, I wish I had my PowerPoint here, but just think about what we're doing with the pec major, right? We're lifting it, but we're also pulling it down. And then what attaches, right? SCMs, you get scalenes, you get a whole bunch of things right to the occiput. And what comes out of the occiput, other than the vagus nerve and the accessory nerve and all the things? So now your traps are like this, your shoulders are like this, this is pulling down. What's going to happen to your cervical spine? I bet C1 and C2 won't hold an adjustment, and we wonder why. So.
And now the nervous system has a tougher time communicating, and now allergies and inflammation. Well, inflammation is going to be harder for the body to deal with.
Yep.
And there now, if there is inflammation, which is beautiful that there's a way to test this, and what a nice, wonderful man to be willing for him and his team to test it for free to see if you have this. So then you can figure out your plan.
Yeah. That
takes, do I need to do it in a hurry? Do I have symptoms, or am I symptomless and I'm doing this more preventively? Regardless, I'm opening up my lymph and I'm working my fascia, and I'm starting to be aware of the stress that this beautification is causing the body. And then we could go into spend an entire hour talking about how we got to the point where women felt the need for
Yeah.
needing to beautify their God-given beautiful bodies.
You know, I have clients who powerfully choose to keep their implants for whatever reason. Maybe they have a 2 and a 3-year-old at home. They just got over cancer diagnosis, and they don't have grounding just in life, right? Like they're trying to figure it all out. And some of these women actually have sick pick, and we still optimize their health, and we know what's in the deck. So what's in your wallet, and how do you want to, you know, spend your time, your money, your quality of life? Like they have vitality, and then COVID hits, right? And then all that stuff. Like how, as long as you know your choices to balance life, I think you can play it that way, and know the deeper dive is, why are you choosing what you're choosing? Is it for self? Is it for family? And if you can do that non-judgmentally, I think we win at the whole life game anyway. So is it too late to dive into that?
No, I totally agree. I think that when we first started learning about the dental piece and all the blockades to healing, I'm the personality that was like, okay, I'm at the dentist the next week. I'm getting my amalgams pulled out. I'm having my wisdom teeth cavitation cleaned out, blah, blah, blah. As I started to work with client base, I realized that not everybody can go as fast as hard. It's not appropriate. And then, you meet clients that have 7 root canals, 20 root canals, and you're like, well, I don't want you to pull all your teeth. Like, that's like, okay, so let's say you have implants and you've had dental implants, breast implants, and gluteal implants. Well, am I going to just have you lay on a table and take all that out? That would be more traumatic and detrimental. So Aina and I always talk about a therapeutic index of, if something makes you more stressed to get rid of something than to keep it, there's a profit and loss, so to speak,
Yeah,
like you were
payoff
saying.
and cost.
Yeah, and you got to make the right determination of when is the right time. Like we had a young client recently who has a root canal that was definitely causing, they had some mold exposure in the house. Mom brought her in, and essentially, she had Dr. Caratola look at her root canal, and we were like, yeah, she needs that root canal pulled. There's a small infection. Okay, but she is also 30 days away from going to college for the first time in her life. Maybe we don't do it right now. Maybe we just boost her lymph, boost her immune, send her to college, and then in the springtime, have the root canal extracted. Let's not pull a tooth from an 18-year-old young woman who's about to meet a bunch of new people and be at a new campus and have all sorts of new stressors. Like, you got to take everything into account when you're working with people. So it's, again, this is a very sensitive subject. I understand that. And I want everybody to hear us from our hearts. Hear us. This is not about fast and hard and rip everything out of your body. Mm-hmm. This is about testing, figuring out what is affecting you, if it's affecting you, how much it's affecting you, and making a plan to either offset the effect that it's having on you, or to make the decision, if you feel supported in that, to explant, and then what that looks like and how to support you around that.
Yeah. And in hindsight, if I knew what I know now about my nervous system, I would have loved to have gone back and asked myself, what did I need in this moment, in this moment, in this moment? Because when you're sick and you have brain fog and you don't know what's next or what's going to trigger you next, it's hard to be grounded to make choices and decisions, and so having a support structure and a process to check in with yourself, like what do you need? I think that's it. I think that's the biggest gift that I have now out of all of this trauma, is that I can check in and say, oh, that makes me feel a little off, or that's perfect, or and if it, right now for me at almost 56, if it's not a yes, it's definitely a no, right? Until it's a yes. And then where do I find the grace and ease? And sometimes there's things I need to give up or understand more or be with more, and the more I can get rid of the judgment of myself, mostly, the easier it is for me to hear what's best for me in that moment.
So tangent sort of, but not really. Judgment of self. That's something that I've been working on for a couple of years. It was actually the beginning of COVID. I was having a conversation at the kitchen table. Ayn was sitting across from me with somebody from my family, and I hung up, and I turned to Ayn and I go, my goodness, do I judge people as harshly as I've just been judged on? Like, everything that came out of my mouth was, I heard the judgment from the other side of the phone. And he turns to me and goes, yes. And I was like, whoa, okay, really? He goes, yeah. And I was like, all right, I'm going to start to look at that a little deeper. And I mean, those of you that have been listening to me or have been clients for 20 years, you know that I've been on a journey. And in full disclosure, yep, I've been judgmental of many of you as well as me and myself the most harsh. And I have really learned how to recognize the depths of the entanglement of judgment. And I think, honestly, when you were speaking, it hit me in the heart so much to realize that even if we're brought up in a house where people love us and the parents love us and we're grown up in this beautiful home, society has layers of judgment, of shoulds and shouldn'ts in life for every component of our life, that it is like a mosh pit to work through to find out where you lay with all of that, regardless of how everybody else feels about what we do in our lives. How do we feel about how we live our lives and what we do in our lives? Yeah. It is such a deep entanglement. I know for me, would you mind sharing your story about that? Because, I mean, just even last week doing a podcast with my hair up in a Bam Bam style, and I was like, I'm sitting instead of standing. I was like, okay, this is it. There's nothing left. I'm wearing no makeup and wearing my hair in a Bam Bam style. There's nothing left. I got no shields to uncover. So,
yeah, I think I'm still in the whole process. I think where I am in it is I am able to see where, well, not all the time. I can see where I'm judging. And I'm not at a place where I don't judge. I'm like, oh shit. Oh, excuse me.
It's okay.
Like,
it's fine. No judgments. No judgments.
Doing it again, right? Like,
no judgments.
And it's hard. Like, I didn't know. You know, in the moment of getting breast implants and having people say it's okay, yeah, do it, right? At 48, like, I was in the best shape of my life, and so I thought, okay, well, I'm gonna go for the gold ring, to look the best, to look as good as I felt. And I didn't stop to see what it was running the show. It was all in joy, so I thought, right? And in hindsight, I'm still processing it. It's like, right now where I'm at is like, it was such a privilege to make that choice, like to be able to have the money to do it, to be able to think the outcome would be good, all of this, and to live in America where like you can go and get breast implants today if you want to, right? What's a shame is that we live in a society and a culture where we're fostering this context for women, for girls, for, like if I don't have children, but if I had a little girl, in hindsight, I'd be like, oh, what role model am I setting for her? Now to think of like when I alter myself, that it's okay to do, like what's the message to the children? And I think culturally as women, we are, I was just talking to somebody about this. We're brought up to not take the biggest piece of cake, but damn it, I want the biggest piece of cake, right? It all ties into the same conversation, right? Especially if it's a coconut cream cake. I want the biggest piece, but you're not supposed to do that. Or you're supposed to sit with your legs crossed, or you're supposed to do this, or you're supposed to have this curvy figure, or not curvy figure, depending on what year it is, right?
Yeah.
And what you're supposed to wear mascara on a podcast, you're supposed to dye your hair, you're supposed to do all these things. but we're not taught to check in with ourselves and what we want, and what is authenticity. You listen to Gabor Mate's wonderful lectures on authenticity versus attachment, and I think I can only speak from being a female and who identifies as female. I don't know what it's like for men or for transgender or that, but for me, we're brought up, I think, people pleasers and doing the things and being the fixers, or at least I was, right? Like, and then you give up part of yourself for each of those choices. Not like bad. I think this is what we do as humans, but if we could cultivate true authenticity longer, or earlier in infancy, I think that would be good. There's so many layers. Like, as I'm speaking of that, it's like if you grew up in a single parent home versus two parent home, loving home, versus, like, I was never at a lack of love, and I still, became more attached to making sure I felt safe and secure and doing the things, and that's how my personality is today. Um, so back to your question of judgment, I think it's all of that, from culture to bringing up to um, privilege to needing to look good or feel good at 48, definitely hitting middle age and menopause getting ready to start. And so, yeah, I wanted to look good. And wow, I actually had a shot at it, so why not, right? And so now I'm at 56, like, what do I want to do for myself now? Like, do I want to dye my hair? No. And saying no and letting this grow out, so liberating. I never thought it would be liberating. It may not be liberating for somebody else, but I was like, I kind of like my little racing stripe, right?
And that's the self-judgment. I think what you've done is highlight, and we've talked about in other podcasts, but the first step is just awareness.
Yeah.
And I found, comically, ironically, with the self-judgment, to not judge yourself when you're judging yourself and judging others is kind of like, oh shit, I didn't know how deep this went. Like, I'm judging myself because I'm judging myself, and I should need to stop judging myself over judging myself. Holy crap, what just happened? Like, whoa, I'm gonna, and the gray hair thing, as these followers know, like, I've leaned into it a little bit during COVID
made it
and
easy.
I had so many people telling me to lean in. It was my own, like, I don't know if I'm ready for that. I don't know if I'm ready for that. And it was because of a previous experience of my mom, who colored her hair for years and years and then just one day stopped. Didn't tell me, didn't see her for 6 months, showed up and was like, whoa, what happened? You're fully gray and white. And it just felt like that's exactly what I was doing, because I've been prematurely gray since I was 26, coloring my hair forever and a day. COVID hits and I was like, she's in South Carolina, I'm in Pennsylvania, it's a long way away. And she was the one that was like, how about if we just highlight around the gray because it's silvery gray? But still, I mean, now I'm doing it like twice a year. I look in the mirror, pull my hair back or something, I'm like, wow, there's a lot of gray hair there. Wow. Watching yourself, judging yourself for now over a year, and it's getting easier to not judge myself. And I'm almost at the point where I'm like, I'm ready to, like, own it, really own it. But this is a process for one stupid little thing.
Well, and it's not, in my world, it's not stupid. And what's interesting is, like, where did we get the story that gray hair wasn't cool?
Right.
I mean, have young kids dyeing their hair gray and purple and pink and green, right? Like, why, like, when I go to my hairdresser, like, he's still my hairdresser, I still want him to make it shiny and cut it and do all the things, and he's like, you really need to dye your hair. Like, like, it's embedded in our culture. So
more so for women than men, because a silver fox, right, that's the term we use for a man with silver hair.
Yeah.
Do not use that for a woman necessarily. And it's like interesting, because in other cultures, the wise women and men have silvery white hair.
And I have a question for you. So this is something that I don't know the answer for. What is the difference? I lost the question, but it's around adornment versus like when we like ritual or wearing a crown with pretty jewels, right? I guess that's also even an epitaph of privilege in society and culture. But like there are times when like I want to feel pretty. Why is it that I then go and do my hair and put on makeup or, you know, put on like perfume or a pretty dress, right? Like when is it adornment and when is it not, right? Like I think adornment could be more nourishing versus like breast implants or even like a tattoo, right? Like the permanence and the different things. I think there's a conversation there that I'm not really doing good with my words right now, but there's a difference between.
No, I hear what you're saying. Like, I want to talk about women going out with other women because I've joked about it for years that it's a weird thing that we're going to talk about in a second. But it was what you were just saying earlier when you were talking. You're like talking about getting your breast implants, and you said I wanted to look as good as I felt.
Yeah.
And my heart broke a little bit when you said that, and I was like, now that's something to unpack. Why is it? First of all, what I've seen in my own personal health is the better I feel, the prettier I look. Like, it's weird. Like, I'm watching the mirror change year in and year out because I'm changing on my internal system, and it's showing up differently on the outside.
Yeah.
Better skin, better hair, better nails, clarity in my eyes, my posture's better, all the things, right? Which improves your overall look. And if you're pooping, sweating, peeing, and bleeding properly, then all the systems are working on high alert. It's like having a race car. Everything looks better and it performs better for you. But what is it about us that goes, I feel good, and now I want to show what that looks like on the outside versus just a smile and a brightness in our eyes? And it's true. It's like when it's the same concept of like, I'm going out for a girls' night with all my girlfriends or a bachelorette party, and Ian's always like, why do you always look the best when you're going out with a bunch of other women? Like, it's weird. Like, we go out on a date night, and I'm like, I'll throw on a pair of jeans and a t-shirt and my flip-flops and call it a date. But if it's Jess and Julie and we're going out dancing, I'm like putting on the clothes, looking good. And I've stopped this since because I've called myself out on it, but I've watched this for years and I was like, what is that? And I was like, oh, it's because we compete with other women more than we do we don't get dressed up for men and like our opposite sex we're trying to attract. We're getting dressed up as competition, it feels like, to me. Some of the time.
Yeah. I think... Yeah, I don't know that I had it specifically dressing up for women versus men, but definitely like thinking that looking good made a difference in how I would feel and how I was perceived, regardless if it were men or women, especially in the workplace where I was at, right? Like,
yeah,
just looking good was a status symbol, not so much healthy, like looking healthy, that never rang a bell until now. I feel so shallow. But it's true. Like looking good meant more, being a certain size in jeans growing up. I remember in high school trying to fit into Jordache jeans. Do you remember Jordache jeans?
I sure do.
God, when you're a Greek girl, Jordache just doesn't work for you. Little A-line, yeah. But yeah, just even the struggle trying to get in, laying on the bed, trying to zip them up, and hope they didn't rip when you stood up and things like that. Like it I think that struggle was always, I would even the kids trying to buy the different sure they don't call them Reebok now, but the different shoes, and when you go to school you want to look good and have the cool computer in the cool computer bag. We had lunch boxes or brown paper bags.
Well, yeah, I just had this conversation with one of Silas's friends from football the other night. Like her kid wants the expensive basketball sneakers, not for basketball, but to wear at school. Yeah. And I mean, We have
And
the exact same problem. Silas is like, I want this name brand and this name brand so we can look good to go to school. And I was like, wow. And you definitely don't get this from us at home, because at home it's like there's no.
And so what is that? Is that just
What is that?
marketing? Is that just so I think it's the same seed, the same thing. And it's not like it's bad, but
No.
I think there's got to be a perspective there's a perspective I have now that I didn't have then. And if I had it then, I would have gone for implants again, but I don't think I would, because I think that there would have been a wholeness that it wouldn't have done right by my nervous system if I were able to check in then.
To look, yeah.
I didn't
So
have those tools.
and we've dived into the spiritual side and the emotional side, which I'm happy to do, and I don't want to lose sight of some of the things that you uncovered for me in your presentation at Cellcore in regards to the class 3 medical device. And I mean, so talk about a little bit about your electrophysical background and a little bit more about what that really was and what you did, because I find it, first of all, very fascinating. And I've learned this in other realms in my life where, you think that surgeons are in a surgery and that they know all the things about the equipment. And then when you learn about people that are in medical sales are just salespeople that learn about equipment, that then sell equipment to hospitals and so forth. And then they're in the surgical room with the surgeon, teaching the surgeon how to use the equipment. It all kind of gets a little like, huh? What? But it is fascinating because there are technical people like you that went out and did research. So talk a little bit about that, because I think this is just, awareness is key.
Yeah, and I feel, or my stand is, that what I did is so different than what I see in the breast implant industry world, and that's what kind of hurts in my brain, and that's why I advocate the way I do, because it's a mixed match. And a class 3 medical device is a device in which it can alter physiology, it can it just impact the human body, and basically it's implantable. So cardiac ablation is also like a class 3 type of procedure. So any type of surgery, which now we call procedures, right, to make it lighter, to make it more palatable, that impact the body in such a way, need regulation, need acute studies, and need chronic studies and long-term studies to see how things do. And in the pacemaker world, in the ICD world, we look at that pacemaker for years, 10 years, the valves for as long as the person lives and longer, right? Like, we follow to see, is that doing what it needs to do? And is it missing a beat? Is the electricity doing what it needs to do, getting to the tissues and things like that? Because if it's not, there's a life-altering or they're life-sustaining devices, right? And what I find in the breast implant world is that they didn't do long-term studies. They intended to, but they cut them short because they didn't have follow-up of the patients. And these weren't life-sustaining devices, so they just let the patient be lost to follow-up. In my job, if I had a patient be lost to follow-up, that would be like a ding on my record, right? So we would make sure we follow these patients up. And sometimes it's every 3 months, sometimes it's every 6 months, and then it will go to every year, right? So there's so much more intensity of the class 3 medical devices I worked on as an engineer, and to what we're seeing now, and even the follow-up for the devices in breast implants. I'm not sure if that answers your question.
Yeah, so with cardiology, you were looking at the equipment and seeing its effectiveness to help create to create an ablation, not create an ablation, but do an ablation or other pieces of equipment. They were looking at the efficacy of
Yeah.
what it was doing in the procedure, and then you followed it for 10, 20 years. Because they were life-saving devices, they had systems in place to track the efficacy of that
Right.
equipment and that procedure.
Safety and efficacy.
Safety and efficacy.
Yeah.
Then you went and looked in hindsight after your breast implants were placed to see, okay, how does this class 3 medical procedure,
How did this research, what did they do for this research, right?
and what you found
it was very
was
lacking, very lacking. And then when we look at biocompatibility and biodegradation, like literally the study that they put in their dissertation to the FDA was that they took a breast implant, they put it in serum, some put it in bovine serum, some used other serum, and they kept it at 37 degrees Celsius body temperature for 90 days. That was their assessment. And even in that small window of assessment, they found silicone in the serum, they found the metals in the serum and things like that. And they reported on that, which was great. But how does that reflect a human body over time? And initially in 2006, they never said change out the implants, right? And now they came, the FDA just put out some new guidelines as well. We should give people a link, go to the FDA, you can type in FDA breast implants guidelines and you'll see that they're slowly recognizing the impact that they could have. But they didn't do the testing. If we didn't have follow-up on a pacemaker or registries even after our research was done, we would never know how to improve upon them, how to mitigate some of the, design flaws in the beginning, like things need to change so we can improve. And like in the ablation arena, we now have different energy sources to kill the heart tissue, all due to research and time. And with an ablation, that you can follow someone acutely and like maybe for a year and have that be enough because it's not an implantable device kind of thing. So there's some pretty significant regulatory processes that happen, and there's a lot of data within like even the NIH to know how to do research, and I don't see that the breast implant manufacturers use that. And maybe I'll even call out most all of the industries for plastic surgery, because now they're using breast implants as gluteal implants and calf implants and different things.
And essentially how they've tested this to this point hasn't been in humans. They test to see if something can go to market by putting it in serum for 90 days at room temperature.
And that's how they get a what they call an IDE. Here's an investigational device exemption clinical study you can do on this number of women, right?
So it's like a quick approval for now you can use this device and you can put it in humans.
Only under research.
Under
right?
research,
So,
okay.
So they do that for whatever they said they would do. Like I think Allergan said 10 years, but they really gave the data at 7 years. Don't really know how that happened, right? And for me to get that information takes me to fill out a request from the FDA, and maybe I'll get that in a year or two. But
and Allergan is one of the one of the top one of the top manufacturers of breast implants.
And they just were bought by AbbVie. I think I'm saying that correctly. Okay. So they do this study, and then when they finish the study, they tally all the data, and they tally their pre-lookup data, and they give it to the FDA. And then the FDA goes through all the data, and they say, you can now sell your device, or you can now not sell your device. So they gave conditional approval for them to sell the device as long as you did this. They call it a post-market like approval settle, a PMA, and then you do this, and we'll make sure that data matches this data, and then we should be good to go. But they failed to comply with their post-market approval data, so we never got long-term data. We only had
and yet they're still able to be on market.
Yeah. In fact, every breast implant manufacturer got a warning for one reason or another in their PMA. for different reasons, but it's when you get a warning from the FDA, it's a big deal, and they're still able to sell the devices, right? And so in 2019, they declared the textured implants to be causing lymphoma in patients. So some of those were taken off the market. And at that time, all breast implants are now black box warning, which is the highest declaration you can get before taking them off the market, right? Like that it's oh, what do they call it? It's saying that this can cause harm, and it's literally on the box. But the problem is, who sees the box?
Who sees the box?
The plastic surgeon. So we as people can know if we read the FDA website and the updates and the guidelines on it. But we wouldn't have known until recently, because now the FDA made it a mandate that anyone coming in for breast implants, they have to tell them all these things now. It's a mandated checklist. And if they don't go through the checklist with you, you can have retaliation in the end. But it's we're moving in the right direction for informed consent. I hope all plastic surgeons are taking that part serious. Most plastic surgeons think everything is rare, the systemic illness, the lymphomas, and the FDA just came out on September 8th that breast implants cause squamous cell carcinoma within that capsule. And at the summit, we'll show Dr. Eduardo Flori will give a great presentation on these things, and we'll have Scott Glassberg talk about the guidelines from a plastic surgeon perspective, and then the FDA is actually going to talk on the guidelines as well. But if you're a plastic surgeon and you are putting in implants, and that's your livelihood, I think it's a challenge to then shift to, oh, they cause harm, and if they do cause harm, am I still going to put them in? But that's how my practice is based. Like I wouldn't want to be them, because if they find out they did harm, then they've been doing harm since they started placing their first implant, right? And granted, they didn't know, and non-judgmentally, but I don't know if I knew I was harming patients by giving them a certain supplement,
whatever,
a certain procedure. I think that would be so hard for me to be with.
Especially people that get into an industry of healthcare that want to help people. I mean, whether there's a lot of veins of plastic surgeons, but as we're speaking, there's a lot that do beyond just like, oh, I want to make you look prettier, but restoration after cancers or after some deformed accident of something. And they do God's work. Honestly, they really help people restore their physical bodies so that they can have some kind of semblance and function oftentimes as well with that. And here they are thinking that they're helping women. I'm sure a lot of surgeons think that, and are doing great procedures helping women have a better life because now they feel more full or whatever, yet then they're going to find out that, oh my God, I've been doing damage to these women, and that's disheartening to say the least.
I wouldn't even know how to be with that.
Yeah.
Right. And if in my journey with getting breast implants and then removing them, their journey will be, I think, very similar and eye-opening. So there's so many spokes to this wheel. And at the end of the day, it's a very personal decision to get the implants, and it's a very personal decision to discern if you should explant, right?
So let's talk quickly, if we could, about self-care. So let's say somebody's listening to this, they have breast implants, they're not in a place to get them out. What would be your quick, and I didn't ask you this beforehand, I'm hopeful I'm not putting too much on the spot, but no. What would be your quick 2 to 3 things that women can start to do now?
Drainage. Did I say drainage?
Can you see why we're good friends? Best, we were like BFFs right from the get-go. Drainage.
Liver drainage, kidney drainage, intestinal drainage,
lymphatic.
Yeah, lymphatic is for sure. I don't, keeping things fluid, moving is great. I'm plus or minus sauna with implants because it can be detrimental and it can be advantageous. So that's a personal thing as part of the sweat, but parasympathetic sweat with sauna, post explant is like the best as well. And if you could do lymph before sauna, that's even better. Um, Replacing your nutrients, making sure your digestion is working so you can replace the deficiencies or give what your mitochondria and immune system need so it can do what it needs to do for you. Like that would be number two. And then if you're still having
And how would they support their mitochondria? I mean, lymph and we've talked a lot about lymph, so hopefully they know how to move their lymph. But how would they support their mitochondria?
there's so many ways, from light therapy to making nutritional support, from making sure you have enough CoQ10, PQQ, zinc, minerals. Um, I'm trying not to specifically name products, but
That's
just
okay. You can name products. I don't care.
there's a lot of mito support out there, combination products, and I personally like the Cellcore line.
Yeah, BCATP is great, and I would also say that those are things you can add in, and damaging things that hurt your mitochondria is Wi-Fi, radiation, electricity, and anything you want to talk about electricity from any books you've read lately, Danielle?
I'm just starting some of them, but like in working, so if you have your implants in, know that the silicone shell is a great insulator, right? So conduction and scar matters. I wouldn't go digging in there so much because it's the silicone that is blocking energy. So if we're gonna talk about energy, I think the what I used is grounding, like literally going to lay on the ground, like when I was having anxiety attacks from all the things, like really trying to figure out how to ground and how to manage my nervous system was a big deal. And how I do that now, how I maintain, is I do use, for me, I use something called the Therasage sauna, which it has the red light therapy in it. I'll do that now. I'll do it like once a week, and that really helps my nervous system. I think advanced TUDCA or taurine really helps the nervous system as well and helps you digest. I think it does so many things there. And then removing the toxins, removing the EMF, I should be wearing my blue blockers and things like that. For me, I stopped dyeing my hair and looking at all the toxins, all the impacts, so my body wouldn't have to deal with it. The liver is an interesting drainage pathway in my world, from estrogen to just all toxins, cytochrome P450, all of that kind of thing. So I think that was a little deeper. But electricity-wise, other than grounding, I don't know what else to do yet.
So I'm a big fan of, if you have fluorescent lights, to turn them off.
Oh yeah.
Because they really affect, and I think so many people are surrounded with fluorescent lights and light bulbs that they're not aware of. And please dispose of them properly when you're disposing of them, because they do contain mercury, which is a neurotoxin. So be careful and mindful. I used to
play with that as a kid. Like, oh my God.
So crazy.
I know.
But lights is a huge thing, because the cells hear all that sound that's coming from the lights, and it's very damaging to the mitochondria when you have this one directional light that's not natural light. Like, I'm sitting in a room with a full spectrum light and windows, and then I have shungite and orgone and shuzi and all the things, the seltzer and the harmonizer and the EMF rocks to handle. Oh, and then the stickers, the quantum stickers, to help just create the field of frequency, to get as much scalar frequency, to get away from the one directional frequency, to help heal the body and help the mitochondria.
Yeah, and speaking of scalar, like for me, this is a new deep dive. And if anyone can find scalar technology near them to help them with their lymph and their fascia, that would be great. And like I wish I knew all the devices that could do it. One of the devices I used, because that's all I knew at the time, was something called the ST8, and that was
Yeah.
scalar. That was, I think, probably the first scalar technology out there.
Yeah, I think that's what LET was designed after, was ST8
Yeah.
actually. Yeah.
And so that the whole LET, the lymph enhancing technology,
Yep.
lymphatic enhancing technology, phenomenal. Talk about having, I call it drop in your pocket, like the nervous system work. I love that for that. Um, and when you don't have access to all that, like restful sweat in a sauna is also add value for your nervous system.
And it's completely free to do exactly what Danielle said, is lay outside on the ground without your cell phone, but lay outside on the ground, touching the ground, not with rubber shoes on, but with your feet touching the ground and receiving the frequency from the earth, which is scalar frequency, allowing your body to recommunion, which is what the red light is doing. And just a shout out to Flowpresso, with the infrared that's in Flowpresso, you're getting the warmth of it, you're not getting the light, but you have the nanotechnology that creates the scalar frequency. It's on the back piece, so that when you're going into that deep state of relaxation in the Flowpresso, you're able to get all those frequencies realigned and structure the water inside your body so you can hold to the frequencies.
Yeah, and I wish, so I can't wait in the next few months to dive into, there's a way to look at polarization in the body, which I'm just an infant in this whole thing. And just like a chiropractic adjustment, I'd love to see how a person holds their polarity shift to be in alignment versus not, and what makes people flip. Do you know any of the science?
Yeah, it's when they're
I do.
when their body is structured. It's just what I was saying. When you structure the water inside their body by increasing the frequency, by giving the light therapy and the sound therapy where there's deficiencies, because of all the one directional light that we have and all the one directional Wi-Fi radiation that's around us, it's damaging the mitochondria, right? And it's damaging the cell structure, which are the antennas. So the way to rehab that is you create the proper frequency in the body by putting light in. So the Weber light watch, the low light laser watch we use, Ness Health. I mean, this is all stuff that's surrounding me right now for a reason. Ness Health, I have this on computer radiation when I'm on a computer, but I'll use this all the time for myself to rehab my frequencies. But anything that we can give the body, Flowpresso will do it, Sound of Soul will do it, infrared saunas will do it, drinking hydrogen water will do it. And when you create structured water in the body, now it can hold information. So now the other therapies that you're layering on and the other remedies and the nutrition can be held on and translated in the proper ways that it needs to, because everything is working in harmony instead of disharmony, because the waves are in phase rather than in contrast, because all the water is being structured, it's going to geometric patterns, so it's all in Fibonacci series, which is allowing the healing to occur.
And so where would someone start with, I mean,
red light from grounding, red light, get some kind of red light. Like Ayn and I are always like, you have to have a frequency, something in your house that's creating proper frequencies of light and sound. If you can't do anything else, listen to Mozart or Bach. It creates natural overtones, which heals the body. You can also, red light is pretty easy. You can even get a cheap little $50 light on Amazon that'll give you some little red light if you can't afford a $1,000 Therasage, or you can't afford a $1,500 Weber light watch with attachments. There's all different price points for this stuff. Ness Health is about $3,500 for the frequency generator, which also has like a TENS unit experience in it as well. But iMate is another thing that Ayn has, that is a mu modulation allergy elimination technology, which is a quantum physics frequency reader and then generator. A lot of other people use AO scanner, but there's all sorts of but personal use, I'm like, get some kind of light in your house right away, some kind of therapeutic red light right away, and get rid of all the nasty light bulbs that are killing you. And then hack the Wi-Fi. Like Ayn and I are just buying a new house, and we went through the walkthrough the other day, and the guy was like, so this light switch right here will will handle that, for your light over there. So if you want to plug in your light, and I and I are like, oh, that's where we're going to put the Wi-Fi router right there. So we don't have to put on a timer. We can just turn it off when we go to bed and turn it on when we get up in the morning. It's so easy. So, it's just finding ways to influence your body in a positive way by getting all that light. And sunlight is key. Like going outside every day and getting sunlight, exposing your forehead to the light without, and your eyes. No sunglasses. Stop wearing sunglasses, please. This was a big deal for me. I could not walk outside without sunglasses, without like my eyes, I have light blue eyes and light skin. So I didn't have a lot of melanin. But I fixed that. Dr. Jack Cruz's work, I fixed that with an infrared sauna. I sat in the sauna for 15 minutes a day for about 6 months, about 5 days a week. For the last 4 years, I've tanned and I can tolerate the sun. And I've stopped wearing sunglasses by doing that. I went out and looked at the sunset and looked at the sunrise again for about 6 months every day at the horizon. And now I force my body to open my eyes in the sun. And I've had a chiropractor friend of mine, Dr. David Pascal, who brought to my attention at a seminar, he was like, when you are out in the sun, you always close your left eye and you open your right eye when you're squinting. I was like, really? I do? He's like, yeah. So your whole side, your right side of your nervous system is actually not getting the information from your left eye. So I've forced myself in the last year to open up my left eye, and if I have to squint and close my right eye. And it is serious consciousness that this takes, because I go outside and I instantly want to do this. And it is, I don't know what it's doing. I'm sure it's doing lots of things in my body, but just doing that, it's taken me a long time to get used to it. And when I go to the south, like if I've been in the north for a while and then I go to the south, it takes me a couple days before I'm like, okay, I really want to wear my sunglasses, but I'm not going to do it. But I really want to, but I'm not going to do it. I'm just going to get used to it. And I find if I go in the morning and not that 10 to 2 sun, it's easier. Or in the evening, that 4 to 6 sun, it's a little softer wavelength of the rays, and that it's a little, so I tend to try to do that in the first day that I get there, so that by the next day when it's super sunny, I can go out and sit in the sun.
Yeah, but I'd also be curious just to listen, if you will, and then see if there's any brain spotting, or even EMDR, or any like when that happens, where else does that land in your body that you want to close and not see? Or
all my shit's on the left side, all of it. All of the stuff is on the left side, and I've been unwinding my fascia, and you're all going to hear about the fascia summit that we're doing in October. It's all about the left side for me. All the stuff. It's all left side. It's all the feminine, all the intuition, all the all the past stuff, all the things. And do you know Eileen Day McCusick?
Yeah, well, I follow her. Yeah, for sure.
So her book on, I think it's called Electric Body, Electric Health, or Electric Health, Electric Body. Her second book, or maybe it's her 15th book, honestly. I don't know. Their most recent book. She's so brilliant. Hopefully we'll get her on the podcast soon. But her book and her tuning, biofield tuning book can teach a lot of that to people. And at home, you can learn how to do that with tuning forks. Her sonic slider, I don't have it here right now, but the sonic slider that she sells, she'll teach you. And I've been playing with it with my fascia, and I've been listening to the field on both sides of my body, and I'm like, holy cow, it's so different. It's freaky. It's crazy awesome.
I didn't believe in any of that. And then I ended up in Australia almost 4 years ago, and I thought I was going for a massage, and the lady takes out these tuning forks, and she had studied with her, and she was doing these things, and you can hear the difference, you can feel the difference, and that was the best I felt leaving that session ever. And I was like, oh my God, what's happening? There's a whole new world out there. And the sonic slider is, hopefully I'll get that for my birthday in December. But no, it's crazy. And then each where the sound or the resonance shifts, there's stories there to be told.
Exactly. And the oh God, you had me think about something. I lost it. It's okay. It'll come back if it was really important, because I want to buy you the sonic slider for your birthday is what I was thinking about.
December 22nd. No, you don't have to do that.
That's just,
And
that's great.
it's I just I hope in my lifetime we can streamline this so these tools are what people just use like as a
Oh,
kid.
I know what I was going to thank you. So Moira LoBianco, who I also did a podcast with, she is a sound therapist, and she's classically trained um, musician who delved into sound healing, and she is a magical woman. You will love her. She's going to be at BRMI. Unfortunately, you'll miss it because you have that conflict. But, well, maybe not. We'll see. We'll see how much you get done this week. But Moira teaches people how to become sound therapists. If they go to brmi.online, she has a class there where she can teach people how to become sound therapists and properly do it. But one of the things that Rasmus Scout Bergenhausen, who created Sound of Soul, I mean, I've got a whole page in my, you know, those big Post-it note sheets? Like, I have one in my office that's literally just for when I talk to Rasmus and things he says that I can keep up on my wall because he's so freaking brilliant, and he's like a wordsmith, and he knows language and water, and he knows all the things. But one of the greatest things I ever heard him say was, you cannot escape frequency.
No.
And I have held on to that since I met him, and it helped me so much through COVID, and it's helped me through the people that have all the root canals and I can't ask them to get them out, or the breast implants they don't want to get out. I'm like, frequency always wins, and we create our own reality, and you can turn anything from the field into matter that you want. So if you want to turn those breast implants into crystalline structures, I feel like you can do it. You just need to have the right tuning fork, the right frequency, the right sound, the right light, and the right awareness in your body and the right alignment in your body to allow that to change and shift, because we can create anything we want in our life, and we can turn our bodies into anything. I firmly know this to be true, and I'm looking forward to all of us playing with this a little bit and having some fun with it. So, like, regardless of where you're at in listening to this, know that you have a lot of tools, whether it's tuning forks, it's laying it in the ground, it's red light therapy, that you can start to get your body to align. Now that you know that this might be a thing, how can you compensate for it? How can you assist your body to compensate for it? Because that's regulation. And that's true wellness. Isn't about living in a bubble and only eating gluten-free, dairy-free, tasteless food for the rest of your life, because that's not how Kelly eats. Kelly likes food way too much, and she takes the biggest piece of the cake when it comes to the table. And now, it's learned behavior, all of it.
Right.
Learned behavior. I became a flexitarian. I don't want to miss out on the great parts of life. I want all of it. And I considered getting a tattoo over the last few months, a second tattoo for the first time in my life. And I've vacillated back and forth about whether to get it because I know what it will do for my fascia and my lymph and all the things. But there was a part of me that was like, yeah, but I really just want to put surrender into love on my arm. Just to remember, surrender into love, Kelly. Just stop it and surrender into love.
Do it, surrender.
But I've also got to the point in my meditation that I don't need it anymore. That I've come to the authenticity that last Joe Dispenza advanced retreat with Dr. Schaffner and Heather just shifted me. And I was like, okay, I can come from love and compassion now. I don't need to have it right here, because Silas is always in my heart, and all I have to do is remember that, and then I surrender. So, but if I got it, I was judging myself over it. I was feeling judgment from others over getting the tattoo, and I'm here thinking people are crazy to get tattoos because it was the most painful thing I'd done other than have a baby. Why would I think of doing that again? But it was also the impact that surrendering into my heart has made in my life that I want to really impress upon myself to remember to do it, because it makes my life so much easier. And you know, but I had to resolve all that and get through it and find out what I was really trying to get to.
Yes.
And that's the beauty. Go ahead.
And no, but that's the same thing. Like, I wish for any choice moving forward for myself and for everybody, like, we go through and we ask the why and the why, not judgmentally, but just to be like, is that really what I want? Or is what I really want is love and acceptance? Is this like, and like, I want to be able to teach kids how to do this, and the whole thought process. But it's that it's not that getting the tattoo is good or bad, and very curious, like how can we be curious as kids? right? And then for me, the more curious I am, the more joyful I am in some crazy way.
Well, you're amazing. You have like intuition. You and I, we were tasked through my coaching company or coaching group this last year to come up with core values at True Wellness.
Mm.
And one of my 6 core values is curiosity over judgment. It's literally what it says, curiosity over judgment. Be curious to yourself and to others and ask questions instead of judging as to why. Understand it. It's changed my relationship with my every single person in my life, including me, to be curious rather than judgy. So
Yeah. I
beautifully succinct.
take it forward myself. So
Yeah. So, okay, we know what we can do for self-care. Let's talk about your summit. So we've talked about 2 summits today just for clarity. Danielle's has a summit and I have a summit. Danielle's summit is October
20th, 20th, 21st, 22nd, 23rd. And it's a little different than like the functional medicine integrative summits. It's really more like a symposium, where people will get together for those 4 days. We'll
It's online.
online, it's virtual, and then people will have 4, like you purchase a ticket for that, and then you'll have up to 4 months, probably longer, like the ones from 2020 are still up for people to view. Just we have to have a little boundary there, but at least 4 months of viewing after the summit, because we're going to have like over 30 practitioners sharing their experience from advocacy, regulatory, from the FDA, from plastic surgeons, from what does explant look like from the past 2 years publications, radiology or oncology and immunology, people who deal with breast implant illness, sharing their experiences, and then so much more. We'll talk about how to optimize pre and post explant, and good Lord. Oh, and then we'll have I wanted to have you on there, but we'll get you next time, for lymph people, lymph how to do it and what it is and all of that kind of juicy juice, and to how to help mitigate, and breath work as well.
And then I'm doing a summit the next week with Siobhan Sarner. We're co-hosting, and it's about fascia and chronic pain rescue. And that is October 24th, 5th, 6th, 7th, 8th, 9th. And then we have over 50 speakers, and
wow.
Yeah, it was a huge undertaking, and all sorts of experts of fascia, but also experts in our field and how they relate to fascia from a functional bioregulatory perspective. And through the process, Siobhan had co-hosted or had hosted the Lymph Summit and allowed me to be a big part of that, which I really appreciated. I really began to understand summits and how it all works through Siobhan. And then I wanted to do the fascia, but I didn't know how to do it. And Dr. Schaffner and I were talking about it. And she's like, well, I think Siobhan and you should do it together. And I was like, you think she would do a summit with me? I have no idea. And Siobhan was like, didn't really have the time to take it on. So it was a perfect marriage, in all honesty, that she had never co-hosted with anybody before. I would never do another summit without co-hosting with her or somebody that knows what the hell they're doing. But it was awesome, and both of us got so fascinated with the fascia. So I want to know, when you went to the symposium or the Congress in September in Montreal, can you talk a little bit about fascia, what you learned, the Fascia Congress?
Yeah, and the sad thing is it's every 3 years, right? And
Yeah.
this past one was 4 years of a gap, and so this was my first one.
How many people were there?
Oh, I don't even know. I mean, I honestly,
Over 500? Less than 200? I'm just curious.
I think like maybe 650.
That's awesome.
Yeah, because it was their first live for 4 years.
So it was the same size as Cellcore. Cellcore had about 670 at live.
Maybe, and I think some people didn't. So I'd say 500, 600.
Okay, that's great. Okay, so about 500 or 600 practitioners, right?
Yeah,
Mostly.
from manual therapists to what I met an anesthesiologist who does chronic pain, looking into it. Like I'm a PA coming into it, like not quite manual therapy. So what was really awesome, and then there was a family med and a chiropractor, like looking at how this all interplays, right, with healing, with health, and all of that. And then there's I think a well-known gentleman by the name of Robert Schleip,
Mm-hmm.
who he had a lot of things to say, and Carla Stecco was there, and Katerina Fede, which you would love to meet her. She talks about hormones and fascia.
Robert Shelp's going to be on our Fascia Summit.
Oh, nice. Um, Ask him about, he had a couple of poster sessions, or his students did, but there's so many take homes. And that take home was how stiffness of fascia correlates with depression, or does depression correlate with stiffness of fascia? Right. So
Ooh.
that's a whole awesome conversation. And there's more to approach it, but which becomes what, right? And so you think of people in chronic pain or connective tissue issues, and how they hold themselves and their lines of tension, and what that can do to the nervous system / neurotransmitters. And like, so I geeked out on in that realm. And Katerina Fede led a pre-summit like microbiology session, and talked some about hormones as well. What I was there for was to really see how scar tissue / breast implants would play a role, like to learn more about this. And one of my most enlightening things, and I wish I had the handout there, was seeing Freya, the work that it's the plastinate work, and it's a whole body, and you can see all her fascia. So it was a fascial dissection, and she was a 70-year-old lady, and you can see all the interconnectedness, all the spiralness, all the things. And they had a great picture, not a picture, but the way her body was almost in a dancer's pose. You could see the whole interconnectedness of the breast, of the pec, of the transverse abdominal area. And like how, for me, that brought home, what are we doing with breast implants? And like, and if you lift that layer and you put something in, you've just tightened it up or loosened it up, and you babbling. But it was beautiful. And so then on top of that, there was some research on physical therapy post mastectomy, and how that changed, mobility, and how that mobility changed strength and function and, attitude. And then talking with them and seeing if we can do that with breast implant, breast explant type of conversations. And then more was on what are the impacts on the cervical spine and the different head posture and scar tissue with that. So that's what I took home from that couple of days.
And fascia, if for somebody's listening to this and I have no idea, can you explain fascia a little bit? Just because I know this is going to air right before the Fascia Summit, and I want them to understand a little bit about fascia and why it's so important. I mean, you have a lot to say about lymph and fascia both, and both of us find that you can't separate these, and if you love one, you have to love the other. It's a synergistic relationship, and it would be just nice for them to hear it, I'm sure, from somebody else other than me.
So I struggle with defining it. I mean, I can give you like the textbook thing, but I want to give you the Danielle colorful way.
Yeah.
Fascia for me is the tensile strength of the body. It is what holds everything together and interconnects everything through organs, through surrounding them, to encasing them, to protecting them. Gil Headley did one of his lives, and he showed a weight at the end of a muscle, and the muscle couldn't hold up the weight. And then he said, this is fascia, and the fascia held up the muscle. I mean, the fascia held up the weight just perfectly. And now we have videos of it under the skin, live, and you look at all the different things that can travel through and on, and inner fascia, whether it's hormones or liquid. And I just wonder what else. It's a transport system, right? Just like the lymph is too, and they work together. when you think of the interstitium, that's all part of the fascial, the housing of the fascia, housing of the body. So how I look at it is like there's many little parts that we still don't know about fascia, and it is an organ system, and it has its functions, and I have a feeling it is the frequency, it is the electrical portion that we have not recognized and have dismissed, right? So when that is dry, when that is stiff, when that is shut down, we don't have as much vitality, as much vibrational support as we need. So to keep that healthy is so important. And how to keep that healthy, I think we're just learning how to do that, right? Especially if you think about how we age. There's some documents out there, videos out there. It's like if being put in a rubber band, right? Like as you get older, you can't lift your leg as much, you can't do the things. And so love to hear regenerative medicine on that. Like, how do we keep that moving? Not just moving, like we know exercise and eat right and get the sunshine, but like I think there's so much more that has to do with how we age and how we get sick.
Well, and stay tuned to the Fascia Summit. You can register. There'll be a link here for both of our summits for you to register for that. And the first week is free. If you want to own it, you do pay for it, which I would highly recommend because of exactly what Danielle said. Learning how to take care of your fascia is the key to our overall health. And there are 50 experts on that Fascia Summit teaching us exactly that. Simple ways to hack your life to take care of your fascia, everywhere from supplements to remedies to lifestyles to avoidance of stuff, to assure that you have control over your health, because that's the point of this entire podcast. That's the point of my life work, is to teach people how their body really works, teach them how the universe really works, so that you feel, I used to say, I wish that we got the, How to Live Life for Dummies book when you're born. Like, yeah. Why is that not a book?
We should do a Fascia for Dummies, Lymph for Dummies.
Yes. Well, I kind of did. I did a Lymph for Dummies for the Lymph Summit. I did a 29-page book on the lessons of the lymph. And I just said this morning in a meeting that I had that I was going to do the same thing for fascia. I'm going to write a book on the fascia because I think that these are the books for how to live your life. Yeah. This is the if you want to know how to take care of this, you have to understand how to take care of your fascia and your lymph. And when you understand how to take care of your fascia and your lymph, so many other things just go away.
It's true. And, in osteopathy training, they teach us to listen. And now this might be just the Danielleism, because anyone else said, oh, I was sitting in that class with you and I didn't get that from it. But when we listen to the lines of tension in the body, and I do this because we listen from the top of the head when you're standing up and or sitting down, right? You can do it from many ways. But when you feel the lines of tension and ask why it's there, right? Like it could be because you have a tumor, it could be just this is how your autonomic nervous system is, and you relieve that, you can feel the nervous system calm down. You can feel alignment. You can feel polarity shifts, right? And I have started doing this in my practice for about 3 years now, and it's made a world of difference to the vitality the clients have, right? Like you can see a person virtually and do the functional medicine integrative, and that helps. That it doesn't not help. But when you can relieve those lines of listen, hear, acknowledge without judgment, and relieve those lines of tension for yourself or have a practitioner do it for you, there's something that happens, and bigger breath, more vitality, and then, and that you begin to heal yourself, right? So I think
because it's an expansion of your frequency is what happens.
Yeah.
Our frequency gets so tight and contracted and muffled and suppressed, and what all this work is about is expansion of the human biome and expansion of the biofield, and allowing us to feel that expansion and that connection that really is about 6 feet coincidentally outside of your body. And that 6 feet, when I'm standing 2 feet away from Danielle, we are completely merged as one, and our bodies are communicating. And then if we go so far as to hug, that's just a more magnified communion of our bodies, but it's still starting to magnify once we get within 6 feet of each other and starting to communicate. And that goes for everything that lives.
And if you can imagine, if you are stuck in fight, flight, or freeze, or someone just cuts you off and you can't relax the gluteus maximus, you know, like for the day, like if you're stuck and you hug somebody, it's a big difference than to be relaxed and hug somebody. The giving and the receiving, like there's something delicious and all of that.
There is, and I look forward to being able to hug you soon. And those beautiful flowers behind you are hugging you. I feel them. They're so beautiful. Fresh flowers. Another way to get good frequency. You know, if you're pollen sensitive, okay, don't get pollinating flowers, but get plants in and around. You know, there's the whole series. I mean, that's a whole other podcast. That's a whole documentary, The Secret Teachings of Plants. There's a book about it. There's so many books about it, but that's one of my favorite, Secret Teachings of Plants. But plants emit frequencies. I mean, that's what homeopathic is all about. You know, that's what herbal medicine is all about. There's frequencies in it. You know, you can't escape frequency. Start adding natural frequencies to your body and getting rid of all the man-made frequencies and man and woman-made frequencies, and you'll be better off in every single way. So thank you so much. I know this was a little bit longer podcast, but as you all know, that's the new platform at the Beats. I'm being very specific about who we invite in on the podcast. Not that I wasn't the first 100 episodes, but we really want to go a little deeper on these subject matters and give the experts the opportunity to really give you more like a master class essentially on this subject. But for even a further class of the symposium, definitely register for Danielle's summit in October. And for more information about fascia, please join Siobhan and I for our summit the week later. So
I'm looking forward to that. I'm going to need to watch it on a treadmill or something, because I'll be like our 4-day summit. Like, so we do ours live.
Right.
And like, yeah, well, I gotta connect with you guys to know what a summit is. And we're learning. It's all a journey. And then to watch your summit, but I can purchase the summit so I can watch it at my own.
Yeah, exactly. Because that's the Live Summit too. Like, there's just so many of the summits, like the Body Electric Summit that Dr. Schaffner did 0.1, 0.0, and 2.0. Like, you got to own that stuff, because there's just no way you can keep up with all the information in the week that it plays. At least I can't. I mean, it's 7 or 8 hours every day. So I end up buying them and then listening to them kind of like podcasts. And I just, but it's nice because it's all condensed information on one subject matter, right? That's the beauty. And I love that you're bringing light to the breast implant illness. And thank you for the work you're doing, and continue to do the work. And this is only the beginning of our friendship, Danielle. I'm so excited.
To be continued.
Yes,
Thanks, everybody.
Thank you all for listening. Thank you for being so heartfelt. And please do share this information if it aligns with you, or you know somebody that it might align with. And keep sharing, keep smiling, and breathe it all in and let it all go. Love to you all. We love you. Have a great day, everybody. Thank you so much for listening today to this episode of The Beats. And as your host, Kelly Kennedy, truly from my heart to yours, thank you for your time and your attention today. And if this did resonate with you, please do leave some comments. We would love to hear from you. And if this further you think would resonate with somebody that you know, please do go ahead and share that and hit that notification button so you know when The Beats is available to you. We do some live things every once in a while. And as always, we pray that this information today was not only foundational, but raised some questions for you and helped you be empowered to take actionable, profound steps toward regeneration, because your body is the only thing that heals. And that is our message here on The Beats. Thanks again for listening and for sharing. Have a great day.